if you have problems with your teeth, there are ways to fix them. Either a filling, you could also put crowns, and then when you start losing teeth, you could put dentures, and then you could also put bridges, and then you could also put dental implants. There's a lot of choices when it comes to dentistry. After you have broken all your teeth or you lost all your teeth, then you are getting into what we called full dentures, like this. So this is a full denture. When you take out all your teeth because of you haven't been taking care of them and somebody pulls them all out, you're going to end up with dentures. So you've got an upper denture here, and this is a lower denture. The lower denture looks like that, and this is the upper denture. So you've got upper denture, lower denture. You got an upper denture that looks like this, and the lower denture is the one that bites into it like this. Okay? Well, most people, if they could keep their teeth, they don't have to have dentures. But once you lose your teeth, this is one way to replace them. If you don't have any more teeth, you could have a full denture like this for the lower, or if you look at the difference between these two, this is what we call a partial denture. And this is what we call a full denture, which means that this is replacing all of your teeth. So if you look at this versus that, you still have some teeth left. But if you lose all your teeth, you are going to have something like this. All right? So now, again, there's always choices that you've got. You could either just have a full denture like this, which just floats inside the mouth, or you could have a denture just like this one, where you could put dental implants in. So you could see there's a dental implant right here. You could see the dental implants. So these dental implants help. So the dental implant would look like that. And these dental implant helps the denture stay in place so that they don't move. So that these guys, so the partial denture, the full denture, whatever denture you have, partial or full denture stays in, and it's held by the dental implants. So the dental implants look like this with no teeth. These are the implants that the dentists are able to put in, and then the full denture on the lower sits right into that. In our office, we are able to give you choices. We're able to give you choices of the dentures like this with the dental implant, and there's also different types of dental implant that looks like that. So if you're looking at somebody who used to have teeth and they lose all their teeth, you could have different types of implants that looks like this, and dental implants that looks like that. So if there's a risk, it's more just allergies that you might have. The other risk would be if you're diabetic, you might not heal as easily. So the risk-wise, most people do well with putting dentures, putting dental implants underneath the dentures. It's not necessarily a big issue unless you're allergic to any of the materials that we put in, like the anesthetic that we use or the materials that we put in. It's options again. You could either get a partial denture. You don't have to get dental implants. You could get one of these. You could also get a bridge. And now a bridge would look like, let's say for instance, you're missing a tooth, just like that. This is a bridge. You do not have to get a dental implant. You could just get a bridge just like this. Okay? So you could either get a partial denture or you could get a bridge. If you're worried about the cost of a dental implant, the risk of a dental implant, get the bridge. And the bridge is, if you're missing a tooth, you get the bridge. If you're missing a tooth, you get the partial denture. If you're missing a tooth, you could get dental implants with the with the denture. So if you're worried about a risk, if you're worried about your age, you have options. Now, the only time that you don't want to do dental implants if you are worried about the age is if you're too young and you're still growing. It might not be a good idea to put the implants in. You want to wait until you stop growing. If you have diabetes, if you have a high blood pressure, that is when it's more risky. It's risky to do any dental treatment when you have high blood pressure and you don't heal as well if you have diabetes. So you have to know your medical history. You want to be healthy, and then the risk is a lot lower. If you have a denture like this and it's loose, and that's what happens, the denture is going to get loose on you because you don't have the dental implant. So the question would be, if you've got a full denture and it starts getting loose, a dental implant will help that situation because the dental implant will keep the dentures in. Now, the other thing would be, some people, if they have a loose denture, they could surely use a denture adhesive. And the denture adhesive is like a toothpaste, just like that. And then what you would do is you would put it right here, and right in the middle. And that will hold the denture into place if you don't have a dental implant. The best thing that you want to do when you are trying to do savings for dentistry, the best thing that you could do for your teeth is prevention. If you have problems with your teeth, there are ways to fix them. Either a filling, you could also put crowns, and then when you start losing teeth, you could put dentures, and then you could also put bridges, and then you could also put dental implants. There's a lot of choices when it comes to dentistry. Be sure to subscribe and make sure you tap right here for our next video.